Okay, we can go ahead and get started. We might have more attendees come in as we're kind of talking here. So I am Carly and this is Jenna. Welcome to the Podiatry Q&A. We have admissions representatives with us and we also have graduate students. And they are going to share a little bit more about their experience in the field of podiatry, things like what makes an applicant stand out, and a little bit more about the admissions process. So I'd like to start off by having our panelists go ahead and introduce themselves and provide a little bit of background information on yourself and your organization. So why don't we start here with Scott, if that's okay? Go ahead and introduce yourself.
Yeah, absolutely. Can you guys hear me? Perfect. I'm a first year student at Des Moines University, and I'm graduated from the University of Wyoming. That's in Laramie, 7,200 feet elevations, one of the highest Division I schools in the nation. So I'm pretty proud of that. And but yeah, that's pretty much it.
Sorry, we're having a little bit of audio issues. Let's see.
Okay, should be good now. Dave.
Sure. I'm Dave Fletcher. I'm the Director of Admissions at Barry University School of Podiatric Medicine. Barry is located in Miami Shores, Florida, and we are one of the schools of podiatric medicine that is affiliated with a full, regular, traditional liberal arts university. So at Barry, you're not just a podiatry student, but you have all the benefits of everything that any Barry student would have.
All right, we'll go ahead and move to Chris.
Hi, everybody. My name is Chris Calzada, and I am a university recruiter for Western University of Health Sciences. We are located in Southern California, and we are a health professions graduate university. So we have graduate, doctorate, master's, and certificate programs all in the health professions field. And I'm happy to be here and happy to answer any questions. So thanks for having me.
Thanks for being here. Jennifer, if you want to go ahead.
Yeah, I guess good afternoon, everybody. My name is Jennifer Bissett. I am a senior admissions counselor with the Arizona College of Podiatric Medicine within Midwestern University. And I'm looking forward to answering questions and having you learn a little bit more about the university.
Awesome, thank you. Sarah?
Hi, my name is Sarah Judicus. I'm a third year podiatric medical student at Des Moines University. I went to University of Northern Iowa and I'm from the Quad Cities. So been in Iowa much of my life, undergrad, and then stayed here for medical school. But I'll be leaving shortly for my fourth year rotations in about 2 months. So I'm excited to let you guys know a little bit more about podiatry school and Des Moines University.
Thank you for being here. And now Alejandro.
Thanks. Yeah. Hello, everyone. I'm Alejandro Rodriguez, Director of Admission Marketing at Samuel Merritt University, here representing our California School of Podiatric Medicine. We're a private, nonprofit health sciences university, so all our programs are in the health fields, based in Oakland, California, and we're also an affiliate of Sutter Health, which is a big hospital network in Northern California.
Great, thank you. And then lastly, is it Aisha? Sorry if I'm saying that correctly.
No, that's okay. Hi, Aisha Manzoor. I'm a year podiatric medical student at Midwestern University in Glendale, Arizona. I did my undergrad and grad school at Rutgers University, New Jersey, which is where I'm originally from. So they change all the country, but I'm excited to talk well about why I chose Midwestern and why I definitely recommend Midwestern to other students as well.
Great, thank you. Awesome. Okay, so we are going to get started with questions that we had submitted in beforehand. So for our first question, can you please just describe a little bit about the admissions process to students? And both graduate students and admissions representatives, I think, can speak on this. If you could include maybe things like a general timeline of the application cycle, as well as admissions requirements such as GPA, entrance exams, letters of recommendation, and things like that. Anyone can also kind of jump in.
So I guess I will start. So overall, the nice thing with the colleges of podiatric medicine is that AACPM, which is our organization, they publish everything. We keep things pretty standard and universal amongst all the colleges. Some schools have additional classes that they may look for, but the standard prerequisites are pretty consistent across the schools. Schools typically do require the MCAT, although some schools are making an exception. With Arizona College of Podiatric Medicine, we do prefer to see that applicants have at least a 3.0 science GPA and a 3.0 overall. And we are still requiring the MCAT, and we prefer to see at least a 493 on the MCAT as well. Podiatric shadowing is always encouraged, although we know it's hard to do right now.
And I'll just contribute to what Jennifer said. The association does help us to organize a lot. So in terms of the time frame, the application opens for all schools in early August every year for the following August. And then the deadline, each school may set a separate deadline, but generally they tend to be the end of June the following year, depending on how the cycle itself goes. Once this application is submitted to the association first, it has to go to the association, and then you're listing which of the 9 schools, one or all, you want your application to go to. It has to first be verified by the association. So they need the application and they need all of the necessary documents, your transcripts and things like this. And only after the association verifies it, is it released to us that we can then begin to review it and so forth.
Great, thank you. Does anyone else want to add anything to that before we move on?
Yeah, I can add just real tip because I heard you mention the letters of recommendation. So we do require those, one being from a podiatric physician. The other thing we do, which other schools might have something similar, is in-person interviews when we were on campus, but now we're doing them virtually just to allow an opportunity to learn more about each candidate.
And I'll go back and address the shadowing that Jennifer mentioned and just expand on that a little bit as well. Shadowing of any profession, whether it's engineering, whether it's being a chef, whether it's being a physician, it's obviously important. But a lot of times I get a question from students or from potential applicants, how many hours of shadowing do I need? As though there is some kind of magic number and as though there is some kind of magic, well, if I check the box that says shadowing, then I'm good. Well, why do we shadow? Right? We don't shadow just to say we shadowed. We shadowed to know what the profession is, to understand the profession, to be able to talk coherently about what it is, what you like, and perhaps what you don't like. So while shadowing is probably the best way to get to do, to know that, there are other ways. For example, there's obviously a ton of ways through social media now. So while it might be difficult now to do shadowing, there are other ways to get to know the profession. And don't think of shadowing as a golden ticket. Think of it as one way of knowing the profession so that when you sit down in an admissions interview, you can discuss intelligently with your interviewers what it is, what it isn't, what you like, what you don't like, and so forth.
And if I can just add a quick comment, everybody pretty much summed up everything very, very well. And as it was mentioned earlier, pretty much all of the 9 colleges have very similar requirements like prerequisites and so on and so forth. But it's always a good rule of thumb that I always tell prospective students or applicants to always reach out to each individual school, check the website, contact advisor of any maybe small differences that might be in a requirement, because there may be some type of small difference, maybe a letter of recommendation requirement or something like that. Maybe the interview process is different. So it's always good to reach out to each individual school to see what those individual, difference of requirements may be.
Great, thank you. And then I guess this is a little bit of a follow-up question that I know has been pretty common with students. Have any of those requirements for admission been adjusted or changed because of the COVID-19 pandemic?
So Jennifer did mention that some schools are waiving the MCAT. In general, the MCAT is a requirement of all 9 podiatric schools, and no one is allowed to waive it. But we have, as a group, made the option for the last cycle and this current cycle that schools could choose to waive it on a case-by-case basis. So one school may choose to waive it and one school may choose not to waive it. Or if a school does choose to waive it, they may have their own criteria. For example, only if a GPA is a certain number or whatever it might be. So in general, those the waiver can be obtained, but you need to contact that individual school. And again, the thing about shadowing, we really want you to have shadowing, but we know that it's been very difficult to do that in the last year or so. And so we will certainly take that into account.
I will add one additional thing. I completely agree with what Dave already mentioned, but one of the things that we'll focus on too is obviously we know things have been drastically impacted this past year. So make sure that you include the activities and the community service work, extracurriculars that you may have been involved in pre-pandemic as well. So from the time that you've started within your kind of college path, or anything really post high school, make sure you're telling us about those experiences too, because while we know things have been impacted currently, we know you're probably involved and engaged within various activities pre-pandemic, and that'll help give us an idea of what you would do kind of in a normal situation.
Another item that changed drastically was we would host, obviously, the interviews on campus. So we would have people traveling from across the states to come visit the campus and do the interview. Since then, kind of something good that's come out of it is the ability to not have to worry about the travel and that expense, because now we're just doing all the interviews virtually, and you have to just become creative with how you present your institution, how you conduct the interviews, what are the highlights that you can showcase, because really we went from, for example, our case, we went from a full-on day, like a 6-hour day where we're conducting tours and interviews, and then now cut down to about half of that, about 3-hour session where we present the campus, we allow our candidates to meet with current students and ask questions of them, and then wrapping up with the interview with our faculty members.
And one thing also that I just wanted to add about shadowing hours, what I always tell applicants or prospective students is obviously the admissions committee understands the situation with COVID and the challenge that's presenting with getting those shadowing hours, but I think they also want to just see how you are being proactive. And so for Western U, there's an opportunity, as was mentioned earlier with the other representatives here, that there's an option to indicate that you were unable to get shadowing hours due to COVID. And so we have that exception in place, and there's a form that you fill out. But I think that if you are indicating, what are you doing? Are you in contact? Are you using Step Into Podiatry website? Are you reaching out to podiatrists? Have you started that communication or emailing them? At least something to show that you're proactive instead of just saying, oh, it's COVID, I can't get hours. I think that definitely makes a difference when the admissions committee is reviewing those applications and making those exceptions on a case-by-case basis. So just kind of keep that in mind. Still be proactive, still try to do something, and which is better than nothing, obviously.
Great, thank you for the insight on that. And I think we're going to switch gears to our graduate students now. A few questions for you guys.
So yeah, how did you decide to go into a career in podiatry? What were some helpful experiences that you had that kind of made you choose that career option?
And we can start with, we'll go Scott and then Sarah and then Isha.
Yeah, definitely. First and foremost, I would have, just to be frank and honest, I never really envisioned myself to be a podiatrist. Because I think as you grow up as a kid, you're like, you never hear about the field of podiatry, and you apply the traditional allopathic schools, the MD schools, and then And then you kind of hear about the DO schools as well. And so that was my path. And kind of to answer that very first question too, is I didn't quite meet the minimum requirements for a GPA. So one thing I would recommend to those of you that may not have that GPA quite yet, I would recommend that you definitely work hard, at least the last 2 years, to get those prereqs and do the best you can in those classes. For me, I had to, work extra hard, and I actually ended up getting straight A's in those prerequisite courses because my undergrad was in psychology. But on top of that, I had to also do well on the MCAT as well, just to kind of show them that I was, as Chris said, being proactive about the profession and showing that I'm serious about wanting to be a physician. And then sometimes with the way numbers games work, the MD schools may not necessarily, accept you with those numbers. So I didn't get accepted to, in the first cycle, I didn't get accepted to an MD school or a DO school. So it was weird. It just kind of happened where Kent State said, hey, we saw you took the MCAT. Maybe you should be interested in the field of podiatry. And I was like, what's podiatry? I've heard about it, but never really considered it as a profession. And so once I actually reached out to somebody in my area, because I'm from Wyoming, and quite honestly, the podiatrists there are very, very few and far in between. I actually had to drive about 20 miles to shadow a podiatrist. And when I shadowed him, one thing I really noticed and I loved about the field was not only was he doing clinical work, but he was also performing surgery. The variety in his day was just so neat to see. He was also doing x-rays as well. A vast majority of what he practiced wasn't very monotonous like you would see in, sometimes in family practice. I'm not trying to downplay those other fields because every single specialty is very important, but I like that change in pace that he had every single day. And when I saw that, I was really drawn to the field. And then I also asked him, I said, hey, how many hours a week do you work? And for him, everyone practices different hours as well, but he worked 4.5 days, not 4.5 hours, 4.5 days a week. So he had half day Fridays where he'd follow up with his OR patients. And, he had a very good work-life balance where he was also able to coach his children's soccer teams and football teams and things like that, which is something that really made me gravitate to this profession. So something to consider, especially if you're considering to have a family in the future.
Great, thank you. Yeah, I have shadowed a podiatry before, and I was like pleasantly surprised when I joined, and he told me his hours, and I was shocked. So, okay, Sarah, you want to go?
Sure. So my experience that led me to podiatry was, it kind of started with actually looking at all different fields of medicine. So I was privileged enough to do a course at my high school that allowed us to shadow all different areas, like including dentistry, general surgery, wound care, emergency medicine, family medicine. And so I kind of at a young age already knew I wanted to go into medicine. And then I took the route in undergrad studying biology as my major. And I was pre-med president, so I was planning to apply to MD and DO schools. And I did, and unfortunately I wasn't accepted to any programs that first round, which I think was my junior year. And then my senior year, I decided to look into podiatry after I was recommended by my career counselor at college. And I started shadowing. And at the time I was also working as a scribe in the ER. And I just instantly fell in love with it. I think I saw how happy they were at work, and something, not that emergency room doctors don't love their jobs, they do, but they see just, they're always having to have that adrenaline ready for anything. And I liked that, but as a scribe, I wasn't responsible for the patient. It was kind of like, it was like I was shadowing in a way. I learned a ton. I highly recommend scribing if you can get a job as a scribe in any field of medicine, just because you'll learn a lot taking notes for the doctor. But so I really liked ER medicine, but I was kind of like, well, I think it's a little too intense for me. And then general medicine, I shadowed my family practitioner, was a little boring. It was kind of the opposite of the ER. So, and then, like I said, as I was shadowing podiatry, it just every day the physicians that I worked with, they came in with such a good attitude. Like they were so excited to be there, and they had so many different cases and things to work on. And some days were more faster paced, some days were slower, which is nice when it, nice to have kind of that in between. And then just the opportunity for surgery was really, really interesting to me as well. I broke my arm back in high school and shadowed an orthopedic surgeon after that, the guy who did my arm. And I really liked the types of surgeries he was doing. And I became really interested in surgery. But one thing about surgery, if you go the DO or MD route, it's very, very competitive. And so with podiatry, and this will probably answer that question that was just in the question box, in podiatry, you are trained to become a surgeon. So I actually, as a third-year medical student, we used fresh frozen cadaver legs, and we already learned like 10 different procedures on the lower limbs. So you start learning surgery in school, which is very unique compared to MD and DO programs where, depending on if they get into that residency, that's when they start that surgical training. So I really like the opportunity to start learning how to do surgery so early on in the path, and it really keeps you interested. Those first 2 years of school are mostly book work, but then once you start working with patients and learning these different surgical techniques, it becomes a lot more exciting. Not that the first 2 years aren't, but it's just a lot more studying and test taking those first 2 years. So that's kind of how I got into it. I feel like I really sifted through all the different areas. Obviously, that might be a little bit more challenging with the pandemic to see all the different fields of medicine, but podiatry is really cool. And the longer I've been in school, the more I've grown to enjoy it. So yeah, so that's just a little bit about why I chose it.
Great, thank you. And then Isha.
Hi, I just want to apologize in advance. My internet has been going in and out. So I, like Sarah, had a similar situation where I knew I was wanted to medicine, but I wasn't sure which field. So I did look into a few different fields. I looked into optometry, I looked into, the MD-DO route. I looked into pharmacy. I really wanted to get an info on all my options before I decided what I was going to do for the rest of my life. And after I shadowed a podiatrist, I was actually in between MD and DO at that point, and podiatry. But I ended up not even applying for MD DO programs. I just applied for a podiatry program, and I decided that after shadowing, I really liked it. I liked that I knew my specialty from day one. There are more subspecialties within podiatry. But, I knew from day one I'm going to be working with feet, which I was perfectly fine with once I shadowed. And, like the admissions counselor said earlier, that there's not really a perfect number of shadowing. I think I shadowed less than 10 hours, but, it kind of sold me right away. I do wish I had a little time in the OR maybe, but, I'm not really someone that's going to push a podiatrist and be like, can I please shadow in the OR? So, even like the clinic work was enough for me to be convinced. So, that's why I ended up choosing podiatry, and I actually have to do a lot of the info, looking on my own. So that's why I definitely want undergrad students to be more exposed to podiatry now that I'm in a position to be able to tell them more about podiatry.
Great, thank you. We will go ahead and move to the next question.
So I think that a common question that all students have when they're applying to graduate school is what can make their application stand out? And I think maybe admissions reps can talk about what they look for, and then graduate students can also speak on what types of experiences or activities that they had that they feel like made their application stand out during the process.
I guess I'll jump in first. So for us, we look for a pretty diverse student background. We don't want everybody to have just the same experiences, because that makes for kind of unexciting learning experience. We see students that come in with backgrounds from physical therapy. We definitely appreciate students who have been scribes, much like Sarah said. The experience and the exposure that you get is just very beneficial as you're heading into the profession. So that's always appreciated. But I mean, I've seen students that, you know, are career changers. Maybe they worked in business before they came in too. So it's definitely something that having that diverse background can be very beneficial. When you're applying to any type of health professions based program, we know that you're going to have those experiences that are healthcare related. But we want you to, you know, explore those pathways, you know what your options are. So that way, when you do settle on podiatry, that you're confident that this is the profession that's going to meet your goals professionally, but then also, you know, make you happy in your personal life too. So having those diverse backgrounds in healthcare are looked at positively in our eyes, as well as your extracurricular. So there's no real one perfect magic combination. We do look for students that come from all different types of backgrounds with different experiences, and that's what helps make our class unique.
I would certainly encourage applicants to tell us everything. And I don't mean everything, but for example, you know, we do look at things that happen outside of the classroom, for example, work experience or volunteer experience and things like this. And someone might say, well, okay, work, you know, yeah, scribing, that's exciting, or medical assistance, that's exciting, but you don't really care that I worked at McDonald's for 3 years. Well, you don't know what we care about. We might care because, okay, granted, how does McDonald's prepare you to be a surgeon? Maybe not. But if you held the same job for 3 years, that does tell me something about the quality of your work, that your boss decided to keep you around for 3 years, right? So don't you decide what we want to see. Give us everything. And then if it's not something we want, we'll ignore it. But if it's something we might have considered and you don't give it to us, we can't even take it into account. So give us more rather than less, and we'll decide what we think tells us what we want to know about you.
Yeah, I'm not on an admissions committee or anything like that, but as a student applying, I wouldn't recommend anybody do anything that makes them unhappy just because I think it's going to make an admissions committee look favorably upon it. So for me, like, I was really passionate about being in the outdoors because I'm from Wyoming, and I decided to volunteer at search and rescue. And, you know, quite honestly, one of the interview questions they asked me about was there ever a time that you were dependent upon 100%? And because of my experience in search and rescue, I had to say, yeah, I was, because of the opportunity that I had to go out and rescue somebody on top of a mountain because they were stuck in a snowstorm because they were lost. I was able to answer that question, not because I chose to do search and rescue because I thought it would look favorably upon an admissions committee, but because I enjoyed it and it's something I wanted to do. The other thing I would also kind of recommend too is, you know, do the best you can in your classes and show that you're making an improvement. That's what I was at least told by my mentor, is that if you're improving in the last 2 years of your schooling and you're serious about your education and you do well on that standardized test, it's going to look more favorably upon you as an applicant as well. Because it's hard to look through, you know, I don't blame the admissions committee. They can't look through thousands and thousands of applications without having some form of stratifying those applicants. And sometimes that ends up being a numbers game, unfortunately.
Yeah, and I'd build on what Scott just mentioned, that conveying that passion and that interest in the field is very important. And also connecting that with whatever school is that you're applying to that you're really interested in attending. For us, for example, we're heavily involved in community service and giving back to the community. So that comes out a lot. That interest and that passion comes out naturally from students who really want to attend, because that's what they see themselves doing in the future. So making sure to incorporate whatever it is that you're passionate about and that you ultimately see yourself doing for others, in our instance, would be something that you'd want to present yourself during the application and interview process.
and I'll just kind of echo off of what, again, everybody so eloquently already said. I think as Jennifer and Dave mentioned earlier, there's no cookie cutter or specific route to get there. And one thing that I always get, that I hear a lot, is that I'm not the traditional student. And so I always hate hearing that, because I feel like there's no one correct path. Everybody has their own path. And so, yeah, maybe you may not have come from a heavy science major degree background, or maybe you didn't work as a medical scribe, like Dave mentioned, you worked at McDonald's, or maybe, so don't let that discourage you. If this is your passion, like Scott was saying, this is what you want to do, don't let those things discourage you. Or maybe you may not be, you may feel like you're a little bit older, or, whatever those things are, just don't let that discourage you. And if this is truly what you want to do, make sure you do all that you can to, make yourself competitive, and meet those requirements, and look for specifically what those schools are looking for. Like Alejandro said, for his school, big on volunteer and community service. Western U is also, big on community service, volunteer work. So, just keep that in mind. And again, I can't stress that enough, because I get that a lot. I think a lot, it's intimidating. It's med school. You're applying and it's competitive, but don't let that discourage you. There's no correct path. If this is your passion, then just do all that you can, and yeah. So that's what I'll say.
Thank you. That's great advice. And then Sarah and Isha, maybe could you talk about what you think made you stand out on your application, or some activities you were involved in that you think really set you apart from other applicants?
Sure. So one thing I did while I was so I did my master's in between starting podiatry school and undergrad. And one thing I did was I volunteered as an EMT for about a year and a half, 2 years before starting school. And I continued that actually once, I went home for breaks and everything. And so I think that really helped me, because it helped me, with the community outreach portion of it. And at Midwestern, you do have to do about 20 hours of community service. That's changing a little bit because of coronavirus. We don't really know what we're going to be doing with that. I had some hours done already for my first year before the pandemic hit. But that's something I was really happy to choose the school for. And I was able to use my own experiences, because I love volunteering with the community and being able to do that here. I volunteered at the homeless shelter a few times. I volunteered with Special Olympics, which is something that our school is really big with. And something that one of the admissions counselors mentioned was that you don't have to have a heavy science background. I did my major in public health in undergrad, because I graduated and can't get into professional school. What am I going to do with a bio degree? I don't want to be stuck in a lab. That's just personally what I did not want to do. So I decided to major in something that I enjoyed, that could also help me. And I definitely think my public health degree helps a lot with something like podiatry, because there is so many issues with diabetes, for example. So I think it's important, like Scott said, to do something that you love while also folding it into podiatry. And actually, a lot of my personal statement when I wrote it 3 years ago was about integrating all of my experiences. I did research in undergrad, I did a public health degree, I did a master's degree, and I did some research with that. I made sure that all of my experiences kind of came together for me, but also were things that I enjoyed. And it kind of was the perfect thing, that perfect storm that kind of just added up, and podiatry just made sense to me, which is another reason why I picked podiatry, because I'm not sure how much you guys heard of my answer earlier, I'm sorry about that, but I picked podiatry because I know from day one what my specialty is going to be. I know what kind of population I'm going.
Okay, we'll just move on a little bit, and hopefully she comes back soon. Let's see. I think this is a great question that we've had from some people. This is more for the graduate admissions representatives, but graduate students can definitely speak to this as well. What does your school do to promote and support underrepresented students at your institution?
I'm going to be working with,
Oh, shoot. Okay, so whoever feels that they could speak on that a little bit.
Would you ask the question again, just to clarify, please?
Yes, sorry. So this is more towards the admissions representatives. What does your school do to promote and support underrepresented students in medicine at your institution?
So I guess the first question to ask is, what do we mean by underrepresented? And this might go kind of back to Chris's comment about I'm a non-traditional student. Well, non-traditional according to what tradition, you know? So what does underrepresented mean? At Barry University, for example, we are one of the most diverse universities in the United States, period. Not just medical. I mean, you know, for example, this year, our podiatric medical class was 52% female. It's a number we're pretty proud of. You don't find, you know, more than 50% at a lot of schools. We are usually less than 50% Anglo, you know, 25% Hispanic, 25% African. So geographically, 26 different states. But what does underrepresented mean? Is it economic? You know, at Barry, a lot of times minorities are the majority. So what does underrepresented mean? Anyway, I'm not going to keep parsing that. I would say in terms of giving the opportunity for people who may not have had the opportunities in undergrad experience, it is taking a holistic perspective. So, you know, there are certain social biases in, for example, the MCAT. I mean, these, you know, there's a zillion studies you can read about that talk about social biases in the MCAT that can be very demographic, very economically connected. So to not make a standardized test be the end all and be all certainly supports people who may be coming from a non-majority culture. To look at those things other than pure academics. And of course you have to have academics. I mean, if you can't do the work, you can't do the work. But to give consideration for leadership qualities and community service and passion. I always tell my colleagues on the admission team, I will take an A+ in passion over an A+ in academics any day of the week. So if you can, you know, that person who may not have the A on their report card, if they can show that A in their dedication and their passion, that certainly goes a long way. And then another issue when we talk about underrepresented could be related to economic situations. So we try to make sure that we have substantial scholarships that again are not awarded simply for academic achievement, but that also take into account the non-academic achievement when they're awarded.
I agree with what Dave said. It is a very kind of broad-reaching subject matter to make sure that that we're addressing all diversity, being as inclusive as possible. So we do a lot of the same things that Barry does when it comes to reviewing an application and looking at an individual applicant. University within the institution, the Arizona College of Podiatric Medicine has a diversity committee that's made. I'm on it. We have faculty members and students that are on it so that we can, within our program, work towards our diversity. And then on a larger level, the university has representation for a diversity committee, and we have a scholarship initiative that was started just about a year ago that is a diversity-based scholarship, and they offer, I think it's about 5 scholarships out a year to students who, you know, meet a variety of criteria for those scholarships. So it's something that the university on a whole is being very aware of. We've, you know, always tried to be knowledgeable about making sure that our classes are diverse from a whole variety of standards. But that it is something that we are focusing on a little bit more as we continue to move forward and make sure that it is something that's in the forefront in conversations that we're having on a regular basis.
Yeah, and expanding on what Jennifer and Dave already mentioned, yeah, I think it's just connecting them to the resources that are needed, that are available to you at your university. For example, I know with us, we have a Students of Color Collaborative made up of students that host a series of different events and platforms throughout the year. This month, we have our Black History Month event that is hosted by our Office of People and Culture. So there's various things and coordinated events throughout the year that are held at our institution But I think beyond that is just providing the space to have the conversation on whatever issues that come up during the student experience. Because no matter where you're at, I mean, we're in Oakland, we're among the most diverse cities in the world, but we have issues of underrepresentation, diversity, race, gender. I mean, you name it. I mean, there are issues on campus that we have to address, and it's just recognizing that it exists, and that you provide the platform necessary and the space to just have conversations about whatever things come up, and also the different resources available. Besides the student services, also, for example, we have a disability resource center as well. So it's just recognizing the needs of your students and connecting them with whatever platforms it is that you have available at your campus.
And just to echo again, just like all the other institutions, it sounds like, you know, and at Western U, we also do provide a wide variety of different organizations and different support for any type of underrepresentation. You know, like it was mentioned earlier, there's a lot of different, it's such a wide topic that whether it's cultural, you know, socioeconomic, any type of disability, like Alejandro mentioned, we do have a disability center as well. But I mean, lots of different things to support as a student on campus, like, you know, cultural or self-identity type clubs and organizations on campus, to just holding town halls on, you know, what topics are going on right now at the time, or just at all, just to check in with students, see how they're doing and things like that. So obviously, you know, as I mentioned earlier, we are located in Southern California, just right outside Los Angeles. It's a melting pot, very diverse, all types of backgrounds. And so it's important for us to hold true to that, because these are our patients, you know, locally in our clinics. And so it is important, even in the curriculum, we've embedded how bias can be in the medical field. And so even in the curriculum, it's being taught as well, but not just as I mentioned, like clubs and organizations and different programs like that we have as well. So.
Great, thank you. So we're getting close to time here, so I want to make sure everyone has a chance to answer this last question. What would be your biggest piece of advice to students who are thinking about going in podiatry, whether it's something that will help their application, something that will help them feel more prepared going into grad school or the field in general? So whoever would like to speak on that first can go ahead.
I'll start. So I think that one of the things that it was a question that had popped up in the Q&A box, and I think this is the perfect time to address it. Like, no, podiatry should not be your second option. By, you know, becoming more aware of what the profession is, we want, as, you know, representatives of the colleges, that this is your first choice, that you realize the great opportunities that come within this profession. So thank you for being here, for educating yourself a little bit further, because podiatry is a great profession. So are the MD and DOs, but they are all individual and kind of unique in their own rights. And, you know, I think we're pretty awesome, and we offer a great path, a career path with a lot of diversity in patient bases and growth within the profession. But the one thing that I think, in addition to making this your kind of first choice, would be that you enjoy your time in undergrad, because those are the experiences, the knowledge that you gain while you are in school, the experiences that you have, those are all things that translate through on your application. And whether they are specific to healthcare or they are outside of healthcare, that's who makes you who you are. And then coming in, making our program and our class unique and diverse are all things that are very important to us and help you stand out as an applicant. So get involved in clubs and organizations, volunteer within your community when you can, and just enjoy your activities. And that will come through on your application to help make you a strong applicant. Of course, not everybody has a perfect academic trend, and we don't necessarily want students who have perfect academics, because sometimes coming into graduate school, you then struggle a little bit because you haven't had to adjust study techniques or refine time management. So, be okay with your failures while you're in undergrad, and be willing to talk about those in your interview and in your personal statement, because that self-reflection shows us a lot of who you are altogether. So.
Yeah, you said so many good things there, Jennifer. I'll just focus on maybe two. You talked about reflecting on your failures, and we all have them. We all have them. So first of all, remember that just because you did not get admitted to that school doesn't mean that that profession, or maybe you didn't get admitted to any school, that doesn't mean that that profession is not for you or that you're not cut out for it. In the end, there is, one seat available. And just because it didn't go to you doesn't mean, if there's 2 students and there's 1 seat, there can only be 1 student admitted. So don't give up if you don't make it the first time. On the other hand, students will call me and ask, why didn't I get in? What could I do better? And so forth. And sometimes there just isn't enough there to build on for the future. Or maybe the academics were so poor that all of the community service in the world is not going to make you a good scientist, or maybe, it's not just all academics. Maybe you just don't have the personality to be a physician. Maybe you need to be sitting in a lab talking to cells, because cells don't care how you treat them, right? But people do care, and we can see that, so that's an important thing. So be willing to talk about those failures, and don't make excuses for them. And don't just say, well, I failed because my mom was sick, or I had to work at this. That's fine if you then showed how you grew out of that and made the change. After mom got better, or after you dealt with your loss or whatever it was, how did you make the change? If your whole excuse is, well, mom was sick, so for 4 years I didn't do well, we need to see something eventually that shows that you are making progress. And the last thing that I'll just say for all my Iowa people is, I'm a huge fan of RAGBRAI. I've done it 7 times. So I'll be there this summer. Maybe I'll come through your town. That's all.
I have a quick comment as kind of a takeaway. Can you all hear me?
Mm-hmm.
Okay. So I just thought I would mention one thing. I took a gap year, and as I mentioned earlier with the applying to DO and MD schools, I did kind of feel, hurt about it, and that I wasn't on my timeline as far as getting into med school right after undergrad. And looking back now, I'm so grateful that I took that gap year. I learned so much. I learned so much more about podiatry. I worked at multiple hospitals as a scribe in different emergency rooms, in different levels of trauma, or in a level 1 trauma center. And it was just a really good time to take before school started, because, going from studying all the time in undergrad and kind of taking that year break and then starting medical school, I think I was ready to start studying again. I was worried that I would, forget those kind of study skills, but it really just comes back. And the school will work with you to get you to find, your unique way to study as well. But I just thought I would mention that as kind of a takeaway, because that's something that I struggled with a little bit, feeling like, not on the timeline that I was kind of expecting in my mind. And so, but I'm so grateful that I took that gap year. And so no matter what kind of time period you are in your life, take the time that you need to, find the career that you want. And I think podiatry is a pretty great one. So if you do have any other questions, I'm sure at the end of this, they might provide our emails if you want to reach out and we can chat more. But yeah, definitely, look into the different fields and take your time. Like, there's nothing wrong with taking a gap year if you need to.
All right. Well, that is great. Thank you all so much for being here.
Thank you.
Thank you for the students who were joined. We will be posting this on our website. So this will be used for other students that end up being interested in podiatry. So we really appreciate your time and you coming and spending a little bit of time with us.
Yeah, thank you for all of your thoughtful answers, and we really appreciate you being here. And our students appreciate it as well, so thank you.
All right, have a great rest of your day, everybody.
Thanks for organizing it all. Bye-bye.